Hi, my name is Andrew Geronimo. I am presenting on behalf of my co-authors on 10 years of riluzole use in a tertiary ALS clinic. The objective of our study was to describe how 10 years worth of patients at our center, the Penn State Hershey Medical Center, used riluzole from the course of 2007 to 2016, what factors might have been associated with it, and what were the outcomes. So we did perform a retrospective review of these patients that were seen in the clinic. We extracted some demographics, some clinical factors such as their functional rating scale, the occurrence of PEG, tracheostomy, and the time of death. We established a timeline of riluzole use and defined adherence as the proportion of days covered, or the time from or the length of riluzole use divided by the length from prescription to death or censor. We ended up screening 723 individuals and including 437 in the analysis. These were those who were prescribed riluzole. Some information about those patients is included on this poster. You can see the patients, where they were included, and what happened to them in the flow chart in the center of the poster. Just to the right of that, we have information about those who started, changed, or discontinued and restarted riluzole and the dose levels at which those occurred. At the bottom, we have a few pie charts related to the reasons why people discontinued or changed dose of riluzole. And then finally, in the upper right-hand corner, we have information about proportion of days covered, including what the distribution was, the typical timeline where people were on riluzole, and the factors which were associated with it. In the table, we show that the younger the person was, the time of prescription, the higher the FRS-R at initial prescription, and the slower the change in FRS, the more likely they were to have a higher proportion of days covered. Definitely encourage the speaker to tell you more about it, but thank you for stopping by our poster.